part of your talk was about resilient communities and being able to adjust to changes coming up. I think it's very interesting that we've seen a lot of change in the last few years, and things like Zika virus coming up, and even within nutrition and physical activity, e-cigarettes, things that you couldn't have seen on the horizon a few years back. Could you elaborate on that, on how the resilience of a community might help address some of these public health challenges that we don't even know about yet that could be coming up in the next 2, 4, 10 years?
Yeah. Well, this is such a good question. You know, in the wake of Ebola and natural disasters that have hit the United States in the last few years, we've been having a lot of conversations as a country about the importance of preparedness at a state level and at a federal level. But if you take preparedness, like much more locally, down to an individual level and to a community level, I think that there's work that we need to do there as well. I think of this as an inside-out strategy that we need to have. In order to create better health for everyone, we need to have an outside strategy which focuses on changing the environment and on shifting culture, which, as we know, are both powerful drivers of health choices that people make. But we also have an inside strategy. We need to have an inside strategy that focuses on improving emotional well-being, on strengthening people's resources and increasing their own resilience, recognizing that while we are simultaneously working to improve the environment, we're not going to be able to prevent every disaster, every hardship, every source of stress. There will be adversity that is visited upon our kids and upon our communities. And so what we also need to do is make sure that we are strengthening them and equipping them with the tools that they need in order to be resilient. So this inside-out strategy is important. The reason I mention both is I want to elaborate on that for a moment, because people sometimes get caught on one side or the other of that debate.
Yes.
People sometimes think, well, if you just talk to people about being stronger, then you paper over the fact that they are dealing with tremendous hardship in their community. And on the other side, people say, well, if you just keep talking about the environment and everything that's happening to people, you absolve them of any role that they can play in helping to change their circumstances or drive their own health. And like most things, this is not a simplistic either-or argument. We're not talking about either just focusing on one or the other. We're talking about having to do both. Because if we don't do both, if we don't strengthen the individual on the inside and work to change the environment on the outside, then I don't think we can ultimately improve health in the way that we need to. I'll just share one last story from the example I mentioned. I shared that there was a school in San Francisco that I visited that was implementing this meditation-based emotional well-being program. And there was a young man that I met at that school. And I'll tell you, I traveled at that school because I wanted to see for myself what was going on. I'd heard these incredible stories about these extraordinary impacts that they were having. And I wanted to see it for myself. I wanted to sit with the kids. I wanted to meditate with them. I wanted to talk to the teachers. I wanted to hear from the skeptics. I wanted to talk to the parents. I wanted to see what was actually going on in this community. And I talked to this young man at one of the high schools, actually, that had a very similar program. And what he said to me was as follows. He said, when I was young, he said, I was brought up by my dad. It was just the two of us. He's like, my dad worked 2 or 3 jobs just to support us. I didn't have a whole lot of time for me. And he said, and this young man was African American. And he said, I faced a lot of discrimination when I was growing up. He said, just because I was black, a lot of people thought I would never amount to anything. They thought that I would never be at the top of my class. They looked down upon me. And that made him really angry. And the way he dealt with that anger was he started bullying other kids. Now, after he started this emotional well-being program at school, which they called Quiet Time, and they do it twice a day for 15 minutes each at the beginning and end of school. After he started doing that, he recognized slowly over time that when he was sitting in that 15 minutes, that he actually felt calm. And then he had a very simple but profound realization, which is he said, well, maybe that calm person is who I am. Maybe I'm not that angry person. And he started thinking about that more and more. And when somebody would provoke him, then he would just stop and he would do his breathing. And he would remember that he was that calm person. And he eventually went and found those kids that he bullied. And he apologized to them. And he said, that wasn't who I really was. He's like, but I know who I am now. And I would never bully you again. Nobody sat with this young man and gave him extensive training on conflict resolution. Nobody put him through many long and expensive therapy sessions. All they did was train him in how to do this 15 minutes twice a day meditation practice with all the other kids in his school. And it has had a profound impact. That's not to say that we shouldn't work on changing the environment around him. It's not saying that we shouldn't take a hard stand against racism and discrimination. It's not to say that we shouldn't work hard to eradicate poverty. It's not saying that we shouldn't work hard to ensure that education is not just a privilege of the few, but the right of many. We should do all of those things. But if we work with an inside and outside strategy, I think we give ourselves the best possible shot of creating good health for everyone.